Good evening, everyone. My name is Maya King. I am a national politics reporter at Politico and very excited to be here tonight for what will be an extremely fruitful and a very important conversation about obesity in America. Tonight, I am joined by Kenita Seeley, the Chief Policy Counsel at the Black Women's Health Imperative, and Lydia Isaac, who is the Vice President of Health Equity and Policy at the National Urban League. Tonight, we'll have a conversation about the state of obesity across the country, break down why communities of color are disproportionately impacted by the disease, and discuss what can be done to curb the rising rates of obesity in America. So to begin, Kenita and Lydia, I will kick it over to you to introduce yourselves. If you don't mind, Lydia, I will start with you.
Sure. Good evening, everybody, and it's wonderful to be here with you all. My name is Lydia Isaac. I am the Vice President for Health Equity and Policy at the National Urban League. As you know, the Urban League is a historic civil rights organization that fights for the rights of African Americans across the country, but originally started in urban areas. And our goal is to advance a health equity strategy that goes with prolonged life and health for all people, all vulnerable people, but particularly African Americans.
And my name is Kenita Seeley. I'm Policy Counsel for the Black Women's Health Imperative. Thank you for hosting this forum this evening. I'm so happy to be here to tell you a little bit about the Black Women's Health Imperative. It's a national nonprofit organization dedicated to advancing health equity and social justice for Black women and girls through policy, advocacy, education, research, and leadership development. And we ultimately identify the most pressing health issues affecting the nation's 22 million Black women and girls. And obesity is one of those issues that disproportionately affects our communities. So I'm glad to be here this evening to discuss those issues with you.
Thank you both for joining us. So before we start the conversation, I have a few points that I would like to set the stage with. And I'll start by saying that it is Obesity Week. So this is definitely a timely conversation. Obesity impacts about 42% of Americans, including more than 2 in 5 older Americans. New data from the Centers for Disease Control reveal that the number of states in which at least 35% of residents who are living with obesity has nearly doubled since 2018, and childhood obesity is on the rise as well. Obesity is considered an epidemic by the CDC, and it impacts nearly half of Black Americans. Obesity is a serious chronic disease linked to more than 200 health conditions, including heart disease, diabetes, and stroke. Directly linked to obesity, Black Americans are about 77% more likely to be diagnosed with diabetes than their white counterparts, and more likely to have high blood pressure than any other racial or ethnic group. Obesity is one of the leading comorbidities for severe cases of COVID-19, and 78% of people who were hospitalized, placed on a ventilator, or died of COVID-19 were either living with obesity or overweight. And of that, Black people were more than 3 times as likely to be hospitalized for severe cases of COVID-19 than their white counterparts. So a lot to consider in thinking about that data and those data points. And with that context in mind, let's jump in and talk about just why these numbers are so high and what's causing this huge racial disparity when we're talking about obesity. And finally, I think most importantly, what can be done to address the rising rates of obesity in Black communities across the country. Kenita, I'll toss the first question to you. More generally, can you help us understand why obesity is disproportionately impacting Black Americans?
Yes, I think it's important to start this conversation by acknowledging what are probably the biggest contributing factors to rising obesity rates for Black communities and all Americans, which is stigma and the misconceptions. For a long time, people had held an outdated and dangerous view of obesity as simply an issue of individual behaviors rather than a disease. But over the past decade, science and the American Medical Association recognized that obesity is a complex chronic disease that requires support to prevent and treat it like all other chronic diseases. Unfortunately, the antiquated and inaccurate views on obesity continue to persist in interpersonal relationships, in doctors' offices, and even in our policies. The stigma and misconceptions, along with other systemic health barriers like food insecurity, are continuing to put Black communities at higher risk for obesity and the adverse health consequences that are associated with it. According to the CDC, study you mentioned, in 35 states and in District of Columbia, obesity prevalence is at or above 35% among non-Hispanic Black residents. So it is really a problem that is really concerning our community, and that's why the Black Women's Health Imperative is so readily involved in this issue.
Absolutely. One thing that in just coverage of this moment, a phrase that I learned is the social determinants of health. And I know that going into that are the root causes of a lot of these diseases and these disorders that we see. So Lydia, I'd like to toss this next question to you to talk a little bit about the root causes of obesity, the things that we might not just readily see that could contribute to why people and how people are diagnosed with it. Can you talk us through a little bit kind of what the root causes of obesity are?
Sure. I think Kanita started with laid a great foundation for talking about the social determinants of health, and that's the places that we live, work, play, I say dream, go to school, and the context that surrounds us, right? And how that context can contribute to chronic diseases such as obesity. And, a wonderful example is the food environment. If you live in a food environment in which it's hard to get affordable, nutritious, healthy foods, and your income is not high enough, what are you going to try? If you have, mouths to feed, you're going to go and try to get the cheapest thing possible because you're trying to feed your family. And a lot of times the cheapest thing possible is not the most nutritious. High calorie, high sugar, high fat foods that contribute to obesity. And so when we talk about social determinants, we talk about all the things around a person in a community that can contribute to them not living a healthy lifestyle. So, we talk about the food environment, but it's also the living environment. If there's no access to park or recreation, we always talk about kids just playing, not to give my age, but when we were young, we would talk about kids being able to play in the street. Well, if you don't feel safe with your child going out and playing in the street and you can't watch them, you're not going to let them play in the street. So therefore, they're going to be inside. They're probably going to be now on iPads or video games. And we saw that a little bit with the pandemic, with people having to be inside and increasing sedentary behaviors and screen time. And so for us to think about, it goes back to what Kanita was saying about it's not a personal choice. Somebody's not choosing to have their child sit on a couch all day and watch television. They're worried about their child's safety. And would the child rather be outside running their bike, playing with their friends? Absolutely. But if I don't feel safe, I'm not going to let my child do that. And so understanding the complex systems around families, and particularly Black families, and where we live and where we play and where we go to school is really important for understanding the choices that people make that can lead to obesity because of their inability to eat healthy, and exercise and do other, including stress. And I think I want to add the mental health aspect to obesity. A lot of stress causes us to have metabolic reactions that can have us hold on to weight and other things for other reasons. And so all of that combination leads to an environment that encourages obesogenic behaviors as compared to behaviors that would allow someone to live a more healthier, safer life.
Thank you, Lydia. And I'm glad you used the phrase complex, because I think that's exactly what this is, that obesity can impact different kinds of people in different environments. And it takes me to my next question. For you, Kanita, the Black population, as we know, is not homogenous by any means, but obesity is something that tends to impact us by and large. Wanted to know if there's a specific group or groups within the Black community that might have higher rates of obesity than others.
Absolutely. And that's unfortunately as African-American women, us, our community. The CDC study said that African-American women had the highest rates of obesity or overweight compared to other groups in the United States. And about 4 out of 5 African-American women live with obesity or are overweight. In September 2011, researchers at Boston University reported that overweight and obesity in African-American women increases their rate of death, particularly from heart disease. It's not right that, all of our community, our mothers, our sisters, our grandmothers are dying prematurely because of this disease. Add to that the other factors that Lydia brought up. The food environment, food deserts, and some of our communities, it's just not accessible to affordable, healthy foods. diet and exercise, but also the mental stress. And stress will, like Lydia said, will make you maintain weight. And then we haven't seen that more recently than in the COVID-19 pandemic. Black women were hit the hardest, job security, essential jobs across the board. So factors like these are contributing to the fact that racism and systemic racial, structures that we deal with every day in and out from every facet of our lives contribute to our rates of obesity within our community. And the Black women's health imperative has been around for 38 years at the forefront of women's health issues. And that's why we're dedicating so much time and energy today in advocacy to obesity care, because the numbers are astounding and they continue to grow. So it's imperative for Black women in particular to get access to obesity care now.
Absolutely. And that's a great segue to a question that I really would like to pose to both of you, which is thinking about stigmas and misconceptions around obesity, its disproportionate impact on Black women, and even the misunderstanding of how obesity might show up in our lives. It can also show up in policy. I'm really excited as a politics reporter to be joined by both of you who are policy experts. So let's talk a little bit more about how these misconceptions and harmful views might actually show up in legislation that could impact policymaking. Lydia, can you explain what policies in particular might be contributing to rising obesity rates?
Sure. I think there's plenty, actually, and Kanita is going to talk about one in particular, but I think in particular, when you link something like jobs require insurance or to access to care. In order to get care for obesity, you have to have insurance in this country. In order to have insurance in this country, unless you're really low income, you have to have a job. So that's one set. And then if you're low income or 65 and older, you're on Medicaid or Medicare, and sometimes those insurances do not pay for certain obesity care. But it's also on the flip side. Those insurance also don't pay for some of the preventive measures and or help. If you don't have access to a doctor who may catch something early, particularly in kids, and saying, hey, this kid may be a little bit off the growth chart. I believe it was New York City, but there was and it might have been the American Academy of Pediatrics, actually started having pediatricians give prescriptions for fruits and vegetables, right? But if I'm worried about my kid having access, if I don't have access to care for my kid and I can't bring them to a pediatrician may not spot that early in order to start making folks aware. So one of the ways is also how our ability to access healthcare and the care that will help us. Additional ways is, this idea of, not everything is reimbursable in terms of cases for like gyms or ability. We can look at the WIC program. Until very recently, you couldn't use WIC at a fruit and vegetable stand in a farmer's market. I happen to have worked for New York City, so I know a little bit about some of the Bucks program that they use to help the farmers be able to take SNAP benefits. But if you want folks to eat healthy and to move, you need to encourage them and be able to help them use the tools that they have in order to be able to do that. And so that's an example of some of the ways our policies are built in to, another one, I use SNAP a lot because for a while they couldn't buy prepared foods, right? And so there were all these little ways that we built in policies to help people, but then we prevented them from buying the things that would be healthy and be able to help them to lead a healthier life. I think Kanita is going to talk a little bit more about a specific policy.
Yeah, Kanita, please. Would love to hear your perspective on this.
Yes, I mean, as Lydia alluded to earlier, and you as well, Maya, obesity is really a complex disease. There's no one treatment option that works for everyone. To treat obesity, we need access to the full continuum of care, which is crucial. With key parts of obesity care to reach for thousands of people, physicians are prevented from doing their jobs to the best of their ability. And as a result, we see a rising rates and people without access to care. Along with the intensive behavioral therapy, studies show that anti-obesity medications lead to clinically meaningful weight loss of up to 15%. So without actions from policymakers, patients will not have access to these new therapies since weight loss medications are rarely prescribed to eligible patients. Also, obesity is only second to cigarette smoking as a leading preventable death in the US. And nearly 1 out of 5 deaths of Black and white people aged 40 to 85 is attributed to obesity, a rate that's increasing across generations. So with expanded access to care, we can help change that. So that's why we, the Black Women's Health Imperative, supports the Treat and Reduce Obesity Act, TROA, really because it allows for that Medicare population of patients to have access to those anti-obesity medications, so they can have the access, so they can really have treatments of the full benefit of treatments for their obesity and drive those obesity rates down. It's going to take the continuum of care to really drive those rates down. So, this legislation, when you have legislation that's outdated, it's only recently that the CDC said, the American Medical Association said that obesity is really a disease. So now that it is treated as a disease and probably as a disease, you need to have the full spectrum of resources available to the patient so they can actually have access to treatments to reduce that obesity. So that's why we support TROA and legislation like it.
Right. So there are policies that can be harmful, or I guess actively work against folks who have obesity, but also policies that can help and make things better. So Kenita, while I have you, since you did mention the classification of obesity as a disease, I'm thinking about the fact that we are still very much in a pandemic. And the earlier data points mentioned that obesity is a comorbidity that can actually make someone who has COVID even sicker. So can you tell us a little bit more about the link between COVID and obesity, and taking that even further, how that's related to the way that Black communities in particular have been hit so hard, so disproportionately negatively impacted by the pandemic?
Yes. I mean, COVID, as you know, has hit the Black community, which has a disproportionate effect, negative effects on the Black community, and exacerbated health inequities impacting communities of color, which face, significantly higher risks of serious illness or death from the virus. Counties where more than 86% of the residents were Black had up to 10 times higher death rates from COVID-19, and nearly 80% of the COVID-19 deaths to date were among seniors. And of course, if you're obese, then you're particularly vulnerable to COVID. And found that the CDC found that people living with obesity faced an increased risk of severe illness from COVID-19. And about nearly half of all adults who were hospitalized with COVID had obesity. So it's really, there's a significant link between obesity and COVID-19, and it's all just really hitting the Black community at an alarmingly disproportionate rate. So that's why we need to have, like I said, again, legislation like TROA especially for those older American seniors who are most vulnerable to really have access to the medications that they need to treat the obesity in the community.
Absolutely. And we have about 15 minutes left in our Q&A, in our question and answer session. But I'd like to invite those of you who are attending, who are joining us tonight virtually, to please pose your own questions. We have the Q&A function here in Zoom. I'm really interested in hearing what questions you guys might have for our panelists, because they are absolutely the experts on this. So Kenita just talked about COVID and its impact on obesity as a comorbidity, but I'm also interested in other diseases or disorders that obesity could also exacerbate. Lydia, could you talk to us a little bit more about that and just the impact that obesity can have on other aspects of a person's health?
Absolutely. As Kenita said, obesity is one of the leading risk factors for a lot of chronic diseases. We go back to this word complex because they really are tied together. So those who are obese have a tendency to be more hypertensive, heart disease. It also has a factor in cancer, definitely in diabetes, and other chronic diseases. And the interesting part about COVID-19 is a respiratory disease. And, at times, the more weight you have, the harder it is for you to breathe. And so you have to think about the concept of what the connection is between those two, as it being a respiratory disease, and worrying about your airways and being able to get breath and air out. And so, what we have to understand is that all of these conditions actually have some of the same root causes to them, which is inability to either get access to care, as Kenita was talking about, and or live in environments that encourage healthy behaviors that therefore then reduce the outcome of these conditions. And so when you look at obesity as an environment that encourages healthy eating, exercise, also mental health, right? We have to think about a lot how mental health and stigma, as we've been talking about, impacts people's ability to live healthy. And so access to mental health care, because, we know, and it's not the only thing, but people have a tendency to stress eat. Other eating disorders are also associated with stress. And so those eating disorders can then impact if somebody's obese or not. And so thinking about that continuum of care that Kenita was talking about is really important, because a lot of the risk factors for obesity are also the risk factors for other chronic diseases that are plaguing our nation.
Absolutely. And Lydia, I want to talk to you a little bit more about this idea of root causes, because I think that's so important when we're talking about and thinking about obesity and how it relates to other aspects of our health. So if we're able to address the root causes of obesity, what does that mean for Black Americans across the country who are living with this disease? Does addressing the root causes for obesity essentially look different in doing so in the Black community? And if so, how? How does that look?
Yeah, it's interesting, because as a public health person, my idea is always about prevention, right? And so Kenita's good point about we need the treatment for when people have the symptom, which is what obesity ends up being. But I always looked at it from more what you call, upstream, which is how do we prevent us from even getting there? And how we prevent that is actually access to opportunities, because obesity is not about personal choices, it's about lack of access to choices, right? And so lack of access to healthy choices on the spectrum, whether it's, where you live, the job you have, if you have insurance, if you can afford food, if the neighborhood you live in has healthy food in it, if you or your kids can exercise when you feel like it because you feel safe, is there recreation, is there yoga, is there meditation? Resources is what Black communities particularly, and I love the way Kenita said it earlier, because of racism and white supremacy, is lacking in our communities. And that lack of resources is what is causing the environment that encourages behaviors, unhealthy behaviors that lead to things like obesity, heart disease, and hypertension. And so for me, if we deal with those root causes, if we deal with poverty, if we deal with lack of access to resources, then we provide an environment for Black Americans to live a healthy, happy, whole life. And that's the important part, for us to be healthy, happy, and whole, and how you define healthy, happy, and whole. But right now we can't make that definition because we have so many barriers in the way of being able to even think about or dream about what healthy, happy, and whole is. And that's what's important to me, is getting us to that stage where we can do as much prevention so that you can never prevent something 100%. We're seeing that right now with the pandemic, but then so that for the people who are the most impacted can then get the care that they need. And it's not that the whole community is having this issue, it's that the ones that are, really end up having this issue can get access to the care that they need in order to solve their problem. And that's really important for me in thinking about a community, is preventing these conditions from happening in the first place.
And taking that just one step further, for you, Kenita, you work specifically with Black women in the Black Women's Health Imperative, thinking about these root causes and even access or denied access to these preventative measures. I think Lydia laid out very well how that affects the Black community. But for Black women specifically, what do these barriers look like? And is that different even within the community in terms of how one can prevent becoming obese, and even what that treatment might look like?
I think Lydia summed it up perfectly, and I couldn't say it any better. I think those barriers are, they have obviously exist within the Black community, and that's why the Black Women's Health Imperative, to assist with the Black women of the nation and the obesity issues that we're having, have launched the Reclaim Your Wellness campaign, which is really a campaign to raise awareness about obesity as a national health crisis in a manner that is free of stigma, judgment, and bias. It's really a multifaceted campaign that educates women about healthy eating and staying active, ensuring women have access to science-based comprehensive care. And it really brings leaders from across industry and policy to change us out, reinforce healthy lifestyles and healthy living. And that's throughout the continuum from, as Lydia said, from diet, exercise, and eating healthy. So we're on the preventive measures all the way through the continuum of care with anti-obesity medications. And so we get across the full spectrum. But what's important is that we don't, trying to prevent, but also having access to those medications and legislation like TROA that will help us try to control and reduce those rates of obesity. So that's what we're doing with the Black community for Black women.
Absolutely. And another question that I have, it's kind of related to, I guess, the politics of obesity. What can Congress do to address this? You guys mentioned a few of the policies earlier, but I'm wondering if you, Lydia, could take us a bit further here. I mean, what also could lawmakers, could leaders, even folks in the community do to address obesity?
So I'm going to give the long view question. I think right now we have very interesting legislation on the floor, Build Back Better, which has all sorts of provisions to improve the lives of Americans, of working class, of African American, of people who really need the help. And we need to pass legislation like that. Paid family leave. Do you know what that would do for a Black woman who is worried about her job but is pregnant, and the stress that causes to her? Thinking about childcare, same woman, let's think about her after she has this baby and has to go back to work and have childcare. Think about our transportation system, our environment, the environment our children are going to grow up in. We need to make sure it doesn't continue warming at 7 degrees Fahrenheit per 10 years, where soon we're going to have way too much flooding. So I think there is direct causes that I think we talked about in this webinar, but I think we also need to think about these indirect causes. And the legislation we have now to support families and to support communities is really what's important that Congress can do that doesn't look like it impacts obesity, but it actually does, because it provides a safe place for women to be able to raise their children. It provides a safe place for people to live. It provides jobs for people to have security, and all those things help people live a healthier life, which reduces obesity.
Absolutely. Kanita, I want to pose the same question to you. I mean, you talked a lot about TROA. What else can Congress do, or government leaders who have the power to make these changes do to address obesity?
I agree with Lydia. Like I said, the Build Back Better Act, certainly, and you have the Black Maternal Health Omnibus Act, which addresses a lot of the disparities, maternal health disparities within communities of color, especially Black women, and all that we experience. And those incorporate everything from healthcare to environmental concerns that really are impacting Black women and the disparities that we're facing in maternal health. And address their situation as a whole. Like it's not only just fixating on obesity, but you have to look at the environment, which causes us to have these high rates of obesity. Again, finances, healthcare, access across the board where we're living. So larger pieces of legislation that address those issues in totality will help to reduce the rates of obesity, and including the Treat and Reduce Obesity Act, which is specifically aimed at reducing obesity, obviously, within our communities. So all these types of legislation will help us get some traction in this regard.
Absolutely. We have about 5 minutes until we'll move into the presentation portion of this program, but I had a few other follow-up questions for you both. I think one, Kanita, you just mentioned the Omnibus, and I believe that was a piece of legislation introduced by Lauren Underwood, also a Black woman, one of the youngest members of Congress to be elected, youngest Black women to be elected to Congress. And I'm curious, I mean, what role does representation also play in passing this legislation, or at least being able to understand how obesity might impact Black communities? And I'm essentially asking, having Black women in leadership, what difference does that make in actually being able to pass these policies and understand what Black women need in order to prevent and also prevent obesity, but live healthy lives in the long term?
And I think you just said it, my representation is key. Without representation and having diverse voices come to the table that really bring the voice of the community and let you know exactly what we're experiencing. Someone who hasn't experienced them themselves really can't tell you what's going on in someone else's community. So having representation means a great deal, and can really speak to the issues and experiences of Black women and pass the legislation that needs to be passed to address the issues that we're experiencing and find solutions.
Absolutely. And Lydia, I'll toss the same question to you. I'm glad that you also mentioned a lot of the other environmental factors at work here, things like climate change that can also play a role in one's health overall. I'm wondering, one, in your view, what the role of representation in leadership could play in actually being able to pass these laws, and especially at a time where we have a historically diverse Congress. What or how do you see this record number of Black women in leadership, of women in leadership? What role could that play in actually getting these policies passed, or at least being able to demonstrate, I think, an understanding of the role of obesity, particularly in Black communities?
I think representation is, you don't know something that you have no experience with, right? As somebody who was trained in research, one of the important reasons why diversity research in all of the areas is important is because you ask different questions. The experience I'm coming from, what I know as a person of color and as a woman, as a Black woman in the United States, is different from other folks. And the question I ask about the problems that my community has is always going to be different than the questions that somebody who's not part of that community is going to ask, because the experiences and the contexts are different. And so having women in Congress, Black women in Congress, who not only know our communities, but understand the problems, therefore then can introduce legislation and also perspectives on current legislation to say, this is not going to work in my community and here's why. But if you don't have people from the community there to represent that, even the ones that look good, because we have lots of legislation that looks good and has unintended consequences, because there was nobody there to say, that's not going to work in my community and here's why, and here's how we can adjust this in order to have it be useful for people that I represent. And so I'm overjoyed right now by the representation we have, with the hope that, to use that word, that it allows a voice and perspective that has not been normally seen in this country be seen on this kind of stage in policies that really impact people's lives and make changes. And they take a while. I have to say that, as people think federal legislation happens and boom, everything changes. No, it takes a while. People like Lauren Underwood are fighting the good fight. Things get changed, but they're there in the room putting their perspective in. And that is important, because not only do things get changed, but bad things don't get put in that are going to harm our communities.
And with the last couple minutes that we have here before we open it up, I guess I'll flip it to the other side of this. We know what lawmakers can do. We know how representation matters, but what can regular folks do? People who are watching this webinar and are saying, like, I have personal experience either in my life or that of a loved one, and understanding the impact of obesity in Black communities. Are there some action items that can be taken after tonight? I'll start with you, Kanita.
Yes, absolutely. Everyone, you have a lot of power as an individual. I would certainly advocate for you to call your local, your state, your federal representatives. They're there to work for you. Let your voice be heard. Call them and express your concern that you want to get for the Build Back Better Act, for the Treat and Reduce Obesity Act. Call your legislators and have a discussion and let your voice be heard, and they will, that will make the difference. And the more people that you can get, talk to your neighbor, have conversations, and then the more people that you have calling your local officials, the better it will be. So certainly make the call.
And Lydia, very quickly, I'll take this to you.
Very quick, I'll say similarly, not only for those acts, but for the John Lewis Voting Rights Act, because representation, as you say, matters. And if we can't get our folks to vote, then we won't be able to have the representatives we want. But it's also taking local action. How do you collectively come together as a community to work on some of the issues. For example, if it's a safety issue, if it's lighting at night, if it's parks, if it's supermarkets, how do you advocate or come together to advocate to your city councils and county commissioners to say, hey, we need a better supermarket in this community. We have a voice. I want everybody to remember that every elected official is elected by you and is supposed to be working for you. So you need to hold them accountable to work for you. And as Kenita said, call them, write them, show up at their offices. They're so not used to people showing up at their offices and talking to them. And they'll sit and talk with you. They want to sit and talk with you and know what's going on and how they can help. Most elected officials are not sitting there to get rich or to not help their communities. They ran on the platform that they want to help their communities. And I would say the majority of them, the majority, not all, really do and want to hear from you because they're here to serve. They're public servants. And don't forget, their job is to serve you as a resident of the United States.
Absolutely. Well, thank you both. Remind everyone who's joining us tonight to please put your questions in the Q&A box and we will get to them in just a few minutes. So both the Black Women's Health Imperative and the National Urban League are part of a nationwide campaign called Obesity Care Now. It's working to educate people about the dangers of obesity and calling on Congress and the Biden administration to update Medicare rules to provide life-saving access to obesity care to Americans in need. Dr. Michael Knight, who is board certified in internal medicine and obesity medicine and practices clinically at the GW Medical Faculty Associates here in Washington, D.C., is laying out some of the issues that we've discussed tonight in an Obesity Care Now campaign video that we're going to watch shortly. I'll also note that the National Association of Black Journalists, which is hosting this event tonight, does not endorse any legislation as a nonpartisan body. We care a lot about Black people's health and covering it accurately, but we cannot actually endorse any pieces of legislation. So with that, we will watch this video for a few minutes and then dive into our Q&A.
Nearly 100 million Americans are living with obesity, and communities of color are disproportionately impacted. This isn't just about weight or appearance. It's a chronic disease that can lead to diabetes, heart disease, high blood pressure, and even cancer. And most affected are seniors on Medicare and people of color. As doctors, we know that obesity is a preventable and treatable disease, but our healthcare laws and insurance policies ignore that science and leave too many people untreated. The solution is simple. We need to bring Medicare up to speed with the latest science and expand access to obesity care now. Let's pass the Treat and Reduce Obesity Act and treat obesity as the disease that it is. And in the process, reduce severe inequities in our healthcare system.
Wonderful. So we will get to our question and answers now. Again, please, folks, submit any questions that you might have for our panelists. This is a wealth of knowledge with us tonight. So first question comes from an anonymous attendee who is asking, in addition to medications, what other treatments for obesity is TROA trying to improve or are available under Medicare? I will toss that to you, Lydia, if you'd like to start us off.
Actually, I'm going to toss it to Kenita because I'm not 100% sure about those details.
Okay.
Sorry.
No.
I would say what I'm familiar with is the increasing the anti-obesity medications, having access to them under the Medicare Part D. Modernize, we have to really modernize the Medicare system and the payments. So Medicare Part D currently is outdated and needs to incorporate those anti-obesity medications. It also includes intensive behavioral therapy for obesity. So again, when we talked about it before, and then TROA would expand access to intensive behavioral therapy. So as we talked about before, it's a combination of both of those two elements, intensive behavioral therapy and the obesity medications that will give you that reduction in obesity, that 15% drop. So it's really important that you have the full continuum of care, and that TROA would advocate for that, would provide that for the Medicare patients.
Another policy question for you, Kanita, is talking about the Affordable Care Act. Obesity care was not added to it. And John Baker is asking really essentially how to get the attention not only of elected officials, but those in the Biden White House. Not only do folks need support for this legislation as it impacts folks who are dealing with obesity, but I think part of the problem is getting it into mainstream or large portions of legislation. We talked a little bit about, what can be done to get involved in the push to not only bring awareness to obesity as a problem, but also to get involved with actually making a difference on the legislative level. So what John is asking is, how do you get the attention of leadership, of those in the top who have the opportunity and really the platform to be able to prioritize obesity as the policy issue that it is?
And I think that it's exactly what we're doing now. We're trying to raise awareness, bring these issues to the forefront, and raise the issues with your elected officials, and really bring voice to power to get these in front of, to make the difference. So I think it's raising awareness, it's education, it's coalition building, and it's bringing these issues to the forefront that's really going to make the difference and get into the broader pieces of legislation.
Absolutely. Well, again, we'll encourage those of us who are joining tonight to please continue to ask questions. We don't have any more open questions, so I guess that I'll toss a few to you guys. One thing that I'm wondering is, we are entering an election year. We are, I guess, really, as of today, at least in my newsroom, headed into midterm season. I'm wondering if there are issues that candidates can be talking about on the campaign trail. I think that COVID has very much been something that voters are starting to tire of. But we've talked about tonight how COVID and obesity really do go together, and these are issues that elected officials or those who want to be elected are going to have to talk about. I'm wondering if, in your view, there are ways for those who are on the campaign trail, especially the growing number of Black women who are running for office, to be able to address this topic in a way that might be a little bit more accessible to voters, not so much policy heavy, but even in the ways that we've talked about tonight, to see how this might show up in our everyday lives. Lydia, I'll toss this question to you first. I mean, what might this look like for you as someone who studies this every day? What do you want to hear the folks who are running for office on both sides of the aisle saying about this issue and how it relates to public health?
Yeah, I actually want to tie in the previous question, because I think in this time, particularly, I know we all are tired of talking about COVID-19, but we saw a really historic expansion of Medicaid in particular. And we saw a lot of folks, a report just came out that we didn't have a change in uninsurance in the past year, which sounds like not a big deal, but it is a big deal when so many people lost their jobs, right? So what happened is so many people lost their jobs, and what took up the slack was the ACA, was people being able to join the marketplace and get insurance. And that actually provides a ripe opportunity, as John Baker was saying, for thinking about how do we expand ACA coverage and also Medicaid coverage to cover other conditions, right? Because we're now seeing more people being covered under these quote unquote government funded plans or government expanded plans. And a lot of states, Oklahoma, which you would have never thought, expanded Medicaid just this summer, right? So now we have Oklahomans, particularly Black Oklahomans, who are able to access healthcare and access different services. And so I think what we want to hear our public officials or people running saying is, how can they help pass legislation and actions that will help people get access to health promoting activities and behaviors? One of them is insurance. Other of them is a living wage. I think that's huge. Talk about what can a living wage do for somebody. It can help them access housing. It can help them access education. It can help them access neighborhoods that have resources that are health promoting. And so those are the ways that we can talk about different types of items or issues that impact obesity. And so hearing our people who are running saying, I'm fighting for a living wage, I'm fighting for paid leave, I'm fighting for access to universal pre-K for example, which we know not only helps with education for children, but allows them access to nutritious meals. And all of those issues have an impact on childhood and adult obesity. And so those are ways that they can wrap this idea of what they're fighting for in their communities with trying to combat obesity.
And Kenita, I'll pose the same question to you. I'm also wondering, though, as a leader, or excuse me, someone who works directly with the Black women's health imperative, if you'd like to see more people talking specifically about Black women and the impact of obesity on that particular segment of the community.
Absolutely. I mean, as we know, the Black women electorate has a lot of power. We have the power to turn states like Georgia blue. We have the power to, swing the House 2 years ago. So I think that it is incumbent for elected officials or anyone who's been in the campaign trail to talk about the experiences and speak to everyone across the board, especially, including Black women, and talk about some of their issues and some of their plights and find solutions to some of the issues that we're facing within our community, including obesity. And you can talk about that. Like I said, maybe that people don't want to hear about COVID, but it certainly, shined a light on the disparities that, the communities of color are facing right now. But just really to talk about, I think elected officials really can't go wrong talking about their real life experiences. Again, like Lydia mentioned, the healthcare, the housing, the economy, all these things, again, are tied to obesity and why we're facing such great rates. So if you connect to the community, talk about those issues, find solutions, then I think that will obviously impact our rates of obesity within the community. So that's what I would like to hear elected officials do, address these concerns, especially how they relate to Black women in general.
We have a question for both of you from another attendee who's asking if you could each talk about the importance of culturally competent care when we talk about the treatment of any disease, but especially one that impacts or disproportionately impacts communities of color. Lydia, could you start us off with this? I mean, what does it mean also to have folks who are taking care of us, who are in the doctor's offices or even advising us on how to live our lives, nutritionists and others? How important is it for them to also be well-versed in the communities that they're taking care of, no less a member of these communities?
Yeah, I think it's really important to understand where communities come from and their cultural or ethnic, practices. And I say that because I think many of us sitting on this call or this webinar would say, well, of course, we want to help people adjust how they eat. But if you don't know how folks eat, I come from a community that eats a lot of white rice, right? And so trying to pull white rice away from people in my community is really hard. And so, really understanding that is a staple food for lots of reasons is important to then understand and help them understand how they need to moderate, right? You can't eat quick whole turkey, but that's an example. But also understanding, I know I keep on coming back to the stress thing, but I think it's really important for physicians to understand the context in which their patients live in. So whether it's, they're a single mother or, they're a married couple going through issues or also have 5 children or they have a sick parent at home, understanding the context than to just say, well, you need to find time to exercise. Are you coming to take care of my 95-year-old mother, right? Helping, and then that's culturally competent care. It's not just about kind of ethnic resources. It's about understanding the patient as a whole and being aware of the challenges and barriers they have and then helping them think through the barriers. But it's also being respectful of people's culture. And I think sometimes, I remember listening to a joke where somebody was telling somebody about, it was a community paper about rice. And it was just like, is it a cup of cooked rice? And the doctor was like, no, it's like half a cup of the uncooked rice, half a cup of cooked rice. But what she was trying to explain was like, I'm not telling you not to eat rice. I'm just telling you, you need to cut down the portions, right? And that she got so much further along with so many more people than telling them to take rice out of their diet. And so understanding the importance of certain cultural practices and or foods it's really important in understanding how you can help people to moderate their behaviors around these issues. And so I just think that's culturally competent peers actually really, and respecting a patient or a person's choice and their agency and autonomy is actually really important. And once you violate that trust, you cannot help them.
I'm so glad you said that. I'm reminded of the fact that I was a baby born in the 99th percentile of her weight class. And it was a Black doctor who told my mom that's okay. So I'll wrap up here, but Kenita, I'd like to toss this question to you too, because after all, you do work with the Black Women's Health Imperative. I feel like this is the definition of culturally competent care. How important is that?
It's extremely, extremely important, that we have physicians and healthcare practitioners who are sensitive to the cultural practices and sensitivities of other cultures. And I think it's, as Lydia mentioned, it's imperative that, we feel like we are being heard. A lot of times, this ties into representation as well. And when you have other cultures, they might have implicit bias. So it's really important that we are felt like we are being heard, so that solutions to our healthcare issues can be solved and appropriate solutions can be put forth, and then they can be received, and we can work together to get those accomplished. So it's very important that we have representation of communities of color in our healthcare practitioners, but also that we have culturally competent care across the board.
Absolutely. And so since we're nearing the end of our time here, I'd like to ask my final question of both of you, which is getting back to the reason why we're here, the Obesity Care Now effort. So what can viewers, those of us who are joining us tonight, do to get involved with Obesity Care Now and help and encourage policymakers to update some of the outdated and harmful laws that we might have discussed today? I know that we've talked a lot already at length about getting involved in talking with your lawmakers, but specific to the Obesity Care Now effort, Kenita, what's the best thing that folks here tonight can do if they want to continue this work?
Absolutely. Well, thank you for the time this evening. I think the best thing they can do is go to obesitycarenow.org and follow the steps to email your legislator and encourage them to help ensure those living with obesity have access to the life-saving care that they need. Through the campaign website, people can help tell Congress to follow the science for obesity care and provide access to treatment. And on the website, you can also find more information and campaign content, including op-eds from the top obesity medicine experts across the country, our letters to legislators, and more.
Absolutely.
So please go to the website.
Well, thank you, Kenita. I will let you have the last word there. That concludes our programming for this evening. This was an excellent conversation. Lydia, Kenita, thank you both for your insights, for your candor, and of course, for taking the time to share your expertise with us this evening. We really do appreciate it. I thought it was a fantastic discussion. And thank you, of course, to our audience for being here and being thoughtful in your questions. And of course, to NABJ for hosting us all tonight. Thank you guys so much. Have a great night and stay safe.